Hey, what's up, everybody? Welcome back to another episode of Health Made Easy. I'm your host, Dr. Jason Jones, and I'm looking forward to this month because we're going to be talking about a condition that affects about 12% of the U.S. population, and probably more than that. They just don't know that they have it because they're not symptomatic yet. And we're going to be talking about TMJ, temporomandibular joint dysfunction, or in other words, your jaw joint. And today what we're going to talk about is what are the causes of these things. Because statistics show that women are much more affected than men. Only 9 women for every 1 man experience restricted jaw movement in their lifetime. But understand that the causes of TMJ or TMJD, however, is important to help you manage the condition. You need to know the factors that predispose you to it, but also the common symptoms to watch out for. So what we're going to cover is essentially the common causes, other relevant details that you really need to know. But we're going to start with, well, what are TMJ and what is TMJD? What's the difference? TMJ, or temporomandibular joint, it's like a hinge that connects the jawbone up there to your cheeks, but actually the jawbone or the jaw joint hinges into the base of the skull, and you have one TMJ on each side of your jaw, and it allows for movement required for talking, chewing, and these joints allow for movement of your jaw from side to side, up and down. They represent one of the most complex joints in the body. TMJD, or what's called temporomandibular joint dysfunction, are conditions that affect the TMJ and cause pain in the jaw and in the muscles controlling the jaw movement. Now, what causes TMJD? Well, the exact cause of every individual is going to be absolutely different. Some doctors believe that the symptoms arise from the jaw muscles or parts of the joint itself, and it could certainly be both of those, or just one or the other. Some other factors that can trigger pain, including arthritis and even jaw injury and genetics as well. Some of the other causes for TMJD are heavy trauma to your jaw from like an accident or getting struck in the jaw, improper biting, displacement of the disc between the ball and socket joint of the TMJ, tightening your facial and jaw muscles due to stress or grinding your teeth, pressure in the TMJ from grinding your teeth or clenching your teeth at nighttime or during the day. Sinus problems, gum disease, and tooth decay will do it too. And the common symptoms of TMJD is what I want to cover now. And you tend to experience both temporary and chronic pain discomfort with it. However, a diagnosis is important as well, since there's many signs and symptoms that may point to the TMJ. So a few of the common signs and symptoms of TMJD are this: headaches, jaw dislocating, neck aches, ear aches, stiff or locked jaw upon opening or closing the mouth, clicking, grating, popping sound when you open the joint or open the mouth or close it, dental occlusion as well. Basically the way the upper jaw and the lower jaw teeth fit together, which is different when you're sitting in a neutral position or standing, or if your head is down or if your head is back a little bit. Being unable to open your mouth very wide, tenderness or pain around the face, ear, neck, or shoulders when chewing, speaking, or opening your mouth as well. And really the big thing is to keep in mind that noises or clicking that occur when you move your jaw are not always associated with TMJD. It's only when the sounds are accompanied by pain or restricted movement of the jaw that it can be described as temporomandibular joint dysfunction, or TMJD, or what some people just call plain old TMJ. Now, most times, a lot of these things they can resolve on their own within a couple of months, and symptoms can be very mild or minimal. But in severe cases, they will last much longer, and you're definitely going to need some help. I mean, we take care of a lot of these things. We get referrals from dentists. They'll take care of the dental appliance, or sort of the thing that they'll put in people's mouth, like a brace or something. And then we'll handle all of the alignment issues that go along with it, which we'll cover in another podcast as well. But the reality is that problems with the jaw are not normal, and they should be taken very seriously because you only get one of them, and repairs on them are lengthy and they are very, very uncomfortable, and I would say maybe not sometimes the most successful either, and definitely something that you want to avoid. So, hey, I hope this helped you out. It's Dr. Jason Jones signing out from this week's podcast. We'll see you on the next one. Bye-bye.